over and down, you're going to feel a little indent. What is that?
Talus.
The talus, right? So this is the talus. You're going to feel a void because that is the neck of the talus, okay? Hey, Mike, do you mind grabbing Eduardo, which is the skeleton?
Oh, I don't know.
I don't know what his name is.
That one, we have a name.
Oh, you have a name, okay.
We disarticulated it.
Eduardo, also known as E-bomb.
Okay. If you go over another thumb, you're going to feel the most prominent bone on the medial side of the foot. What is that? Navicular. Beautiful. This is the navicular. Technically, there's a joint line right there that you should be able to feel. This is the navicular. And then, yeah, exactly. No one can partner with him.
That is easy.
Then you go down another thumb. What is that?
Cuneiform.
Cuneiform. This is the medial cuneiform, but we'll just call it the cuneiform. And you go down another thumb.
The first one.
Well,
What makes up the first
first met base. This together, first metatarsal cuneiform together makes your first ray, right? So this is the first ray moving. So the axis point of that ray is that metacuneiform joint. Okay, remember that's where bunions, so the center of deformity of a bunion is back here. Okay, beautiful. Technically, this is your first MPJ. Okay, medial column. Now, oops, sorry, real quick. So what did we say was the highest point of your medial column? Highest point of the arch? Navicular, right? So you want to think of here. So when we stand, a lot of people actually look here at the arch. Your arch is actually here. Okay, so just understanding that. In a little bit, we'll talk about navicular drop. Okay? Now if we go lateral, beautiful, and we'll just kind of rotate a little bit more. Excellent. So this is her fibula. Right, lateral malleolus is going to be fibula. Your next bony prominence, if you feel along the outside of the foot, what would that be? What is it? Fifth metatarsal, which is also known as the styloid. Okay, it goes posterior a little bit more, so technically her fourth would be here. Right, so it goes back a little bit. If you go posterior and up, what bone is that? Cuboid. So the cuboid is here. I want you to actually feel and palpate the underside. So you see how the bone, so all of this, the bone is not there. That's fat and muscle. Okay, so it goes up to the cuboid. And then we go down. What bone is here? Calcaneus. Right, beautiful. So the highest point of the lateral longitudinal arch is what? Cuboid. Beautiful, right? So cuboid, lateral arch, navicular, medial arch here. Okay? Now we go into our muscles. Tibialis anterior, posterior tibialis soleus. So what we're going to do to find your tibialis anterior, she's going to dorsiflex her foot and invert it. There we go. And if we follow the tendon, it goes down exactly where I drew the first ray. So if you want to know if you were accurate.
Is she a plant?
What was that?
Is she a plant? Planted in the audience?
Is she a plant?
That your drawing would work out that way.
Exactly. Exactly. So there we go. So relax your foot. So she's here. So if you want to know even more precise, tibialis anterior inserts onto the dorsal aspect of the first ray. However, 90% of the tibialis anterior is cuneiform. 90%. Okay? It forms the spiral line with what other muscle?
With
Peroneus Longus. Yes. So Peroneus Longus on the underside is going to be here, right? So right away you want to start appreciating how they connect to each other, okay? They are direct antagonists to each other. Peroneus Longus, tibialis anterior, direct antagonists, okay? Your second inverter, posterior tibialis, if we plantar flex, the other way, and then invert. Yep, good. Here, you'll actually be able to see the tendon jump out, right? If you cannot see it and you just shut your eyes and palpate, you'll be able to feel the tendon, and then you can follow the tendon all the way down to its insertion, which is navicular. As soon as the posterior tibialis inserts onto the navicular, it fans out, and it has how many attachments? 9. It attaches to every bone in your rear foot, midfoot, and the bases, except for what 2 bones? Yep, talus and first metatarsal base. First metatarsal base goes to the spiral line. Talus, no muscle or tendon attachment. Okay? Your third inverter is going to be soleus. Do you mind standing up for 1 second? Thank you. And turn and face that way. Sorry that we are now away from you. So here, I just want you to appreciate that the Achilles tendon, it comes here. Anatomy books show that it's here, but it's a triangle like this. Right? So it's a very broad, it's going to come like this. Okay? So here on the medial side, what inserts here? Soleus, coming down this way. What inserts over here?
Tibialis.
Gastroc. And then how about directly posterior? What do you think that is? So you know, actually more soleus, right? Because 2/3. So posterior medial goes to soleus, lateral goes to gastroc. Okay, but I want you to just somehow appreciate that it's coming down and it's like that, right? So it's not like insert and then boop, there. It kind of comes and it hugs. So a lot of Achilles tendonitis and plantar fasciitis and pain along here is actually calcaneal periostitis. I think I mentioned that yesterday. So the periosteum can get inflamed. Okay? That's saran wrap on the bone. Good. So come have a seat again. Good. Beautiful. So we're going to rotate over to here. So those are your inverters. And now if you kind of, do what you were doing. Like kind of, there you go. The other way. Yeah, like that. Try to make them stick out. All right. So here she's making her perineals come out. Right? So perineals come down here. We get to see them here. They sit together like this coming down. Do you know which one is closer to the bone? Brevis. Yep. So brevis is closer to the bone. Just think brevis, longus, like the alphabet order, right? So they come here. Why I mention that is that as it comes this way hugging around the bone, that's where you get tendon tears because it's making a turn and these bones are sharp. So it's making a turn, so you actually see higher incidence of perineal tears in the brevis. Okay? Comes down this way, and then they split. Here, going here, is brevis. Longus is going to go underneath the cuboid. Okay? Cross the bottom of the foot, so now I just need to see the bottom of your foot. So it goes from here over to here. That is where it's going to run. Okay, so it's diagonal. What does this look like? This oblique line.
The ankle joint.
Your ankle joint axis. Yes. This is your ankle joint axis as well as your Peroneus Longus, Tibialis Anterior balance, which kind of makes sense because they both have that kind of antagonist relationship. Okay? It's going to come over here, insert onto the first ray. Now, if you like anatomy, 90% of your Peroneus Longus is on the first met, which is opposite to the Tibialis Anterior. 90% of the Tibialis Anterior was on the cuneiform. Okay? If we stay over here, posterior tibialis inserts onto your Peroneus Longus. Do you see that connection? Right there. That's an important area of where you will see people get arch pain, and it is misdiagnosed as plantar fasciitis. There. Yep. Okay. This connection, if you've ever heard of plantar layers of the foot, right? So there's 4 plantar layers, superficial to deep. The deepest layer of the foot, you will find this. The closest to the bone is that. Posterior tibialis, Peroneus Longus, and if you know the interossei, that's where you'll find this as well. Those are the 3 structures. Okay? So that just shows how deeply intrinsic that relationship is. Optimize post-tib Peroneus Longus, you got a good foot then. Okay? Good. Last muscle over here is going to be gastroc. That obviously goes onto your calcaneus. Okay? Make sense? Good?